So, if you're on this fertility journey, you've probably stumbled across the acronym OHSS, right? It can sound kind of scary, but it really doesn't have to be. In this explainer, we're going to break down ovarian hyperstimulation syndrome so you can feel totally informed and way more confident about what's ahead. Okay, here's the game plan. We're going to kick things off with what OHSS even is. Then we'll get into the science of what's actually happening in your body. We'll cover symptoms and risks, and, this is the important part, how doctors work to prevent it, plus what you can do at home if you feel any symptoms. And we'll wrap it all up with the single most important thing to remember. All right, so let's jump right in. What is OHSS? Let's get down to the basics and just demystify this thing once and for all. So have you seen this term pop up in your late-night Google searches? It's everywhere. And it is completely normal to feel a little anxious about medical jargon you don't fully get. And that's exactly why we're here, to make it all make sense. Okay, so what are we really talking about here? In simple terms, ovarian hyperstimulation syndrome is your body's reaction to being, well, overstimulated by fertility medication. It's specifically a reaction that can happen after you take that HCG trigger shot, the one that gets your eggs ready for retrieval. Okay, but how does this actually happen? What's going on inside your body? It's really just a simple cause and effect chain reaction, and when you see it step by step, it's actually pretty straightforward. So it all starts with step one. You're taking fertility drugs to grow a whole bunch of follicles at once. Now, all those follicles start pumping out a lot of the hormone estradiol, so your levels get really high. Then you add the HCG trigger shot into that high hormone environment, and bam, that specific combination can be the perfect recipe for OHSS to show up a couple of days later. It's really that sequence of events. Okay, let's get real for a second. Let's talk about what OHSS might feel like and, more importantly, how common it actually is. Because when we talk about any kind of medical risk, context is absolutely everything. In this chart, wow, it really tells the whole story, doesn't it? Just look at this. For the vast, vast majority of people, we're talking 89%, there's no OHSS at all. Nothing. About 10% of people might feel some mild symptoms. But here's the key number. Serious cases are incredibly rare, like less than 1% of the time. So for that small group who might get mild OHSS, what are we actually talking about? Well, it's pretty much what you'd expect when your ovaries have been working overtime. Think bloating, some pressure or pain in your abdomen, and maybe some temporary weight gain from fluid. Sometimes you might also feel a little short of breath or notice you're not peeing as often. But here is the absolute best news, and I really want you to hear this. OHSS goes away on its own. It's temporary. Your body sorts it out, usually within about a week after that trigger shot. It's not a permanent condition, which is so reassuring. Now, you might be thinking, is this just a roll of the dice? No way. This is not something that's just left to chance. Your medical team is all over this with a really proactive plan to stop it before it even starts. And this is how they do it. It's like a three-part strategy. First, your medication plan is totally customized for you, your age, your ovarian reserve, your weight. It's not one size fits all. Then they are watching you like a hawk with frequent ultrasounds and blood work to see how your body is responding. And finally, the masterstroke, choosing the right trigger shot. If there's even a hint of risk, they'll often switch to what's called a Lupron-only trigger, which is known to dramatically slash that risk of OHSS. Okay, but let's say you do end up feeling some of those mild symptoms. What can you do? Well, the great news is there are some super simple and effective things you can do right at home to make yourself feel a whole lot better. And here's your cheat sheet. On the what-to-do list, flood your system with fluids, think water, coconut water, and really ramp up your protein intake with stuff like whey protein or eggs. On the what-to-avoid list, say goodbye to sugars and simple carbs for a bit. Also, you've got to take it easy. No intense exercise and no sexual intercourse. And it's a good idea to weigh yourself every day, just to keep an eye on any fluid shifts. All right, we've covered a ton of ground. What OHSS is, why it happens, and how it's both prevented and managed. But if you remember only one thing from all of this, let it be this next point. This is truly the most important step. And here it is from Dr. Allison Peck. Always remember, calling your doctor and being evaluated is the best medicine. I mean, that really says it all, doesn't it? All this info is meant to empower you, but it is never a substitute for your medical team. They are your lifeline. If you feel anything or you're just worried, calling them is the absolute best thing you can do. So, now that you know the game plan, now that you know your doctor is actively working to prevent this, what's one thing you're going to ask at your next appointment? Seriously, think about it. Are you going to ask about their trigger philosophy or how they personalize medication protocols? Because taking this knowledge and turning it into a real conversation with your doctor, well, that's what this is all about.